Hip dysplasia is a maldevelopment of the acetabular and the proximal femur, or the hip joint. It can be present before and at birth, and sometimes, unfortunately, is diagnosed late. That's why hip dysplasia is present in infants and sometimes in babies. It is also called developmental dysplasia of the hip because in some cases, when the acetabular socket, which is the socket that contains the proximal femoral head, is not well developed, and if this maldevelopment is not diagnosed early, you run the risk of having a worsening of the situation up to the femoral head not be contained fully in the acetabulum and dislocating outwardly. Hip dysplasia was described by Hippocrates 480 before Christ, and still we have some doubt on how to make an early diagnosis and the best treatment. Unfortunately, hip dysplasia doesn't show itself with major clinical symptoms as pain or deformity, while if the hip is fully dislocated or when the femoral head lost its contact with the acetabulum, there are more typical clinical signs as the Ortolani, Barlow, Galeazzi and Ludlow sign, which are specific, done and tested by the orthopedic surgeon. The diagnosis of hip dysplasia and dislocation is nowadays made early, within the first 3 months of life, with an ultrasound screening of the development of the acetabulum. The treatment, of course, may vary according to the degrees of dysplasia or dislocation, and it may vary from just follow-up without any treatment, with splinting, with plastering after reduction of the head if the femoral head is dislocated, or when late presentation is detected, surgical is needed. Surgical treatment is the only treatment that is required when late diagnosis is performed. In the last 10 years, I've been treated more than 10,000 babies non-surgically, and I have performed the same number of operations in dysplasia of the hip from newborn to young adults. I'm always available for any question, any doubt, or any problem you may have, because I understand as a father that every minimal problem with your kid can become a major disaster in your mind, and it's better to have a straightaway answer and clarification so you can relax for something that is normally not important. I'll be happy to answer you on the YouTube channel anytime you write.